This is a manual muscle test of the elbow, specifically pronation. The muscles tested are the pronator teres and the pronator quadratus. For grades 5, 4, and 3, the patient will be against gravity, standing or sitting with elbow flexed at 90-degree angle. The forearm should be neutral with thumb pointing up. The clinician should stabilize at the lateral humerus against the trunk and resist at the lateral distal forearm. To receive a grade of 5 out of 5, the patient must hold against maximal resistance. To receive a grade of 4 out of 5, the patient must hold against moderate resistance, but eventually they break. And for a grade of 3 out of 5, the patient can complete the range of motion but cannot handle any resistance. For grades 2, 1, and 0, the patient will be across gravity. They'll be laying supine with their elbow flexed to 90 degrees. The clinician will palpate the pronator teres at the proximal aspect of the radial forearm and stabilize the humerus against the trunk. For a grade of 2 out of 5, the patient completes range of motion. For a grade 1 out of 5, there's a muscle contraction, but there's no movement. And for a grade 0 out of 5, there's no muscle contraction. Compensatory movements for pronation include shoulder abduction, shoulder internal rotation, and contralateral trunk flexion.
Manual muscle testing of the elbow is supination. We are going to be doing the biceps brachii and the supinator for our muscles that are being tested and palpated. For grades 5, 4, and 3, the client will be positioned standing or sitting with the elbow flexed to 90 degrees and stabilized against the lateral trunk with the forearm neutral or the thumbs up position. The clinician will force against supination with resistance on the lateral distal forearm with the fingers grasping ulna with the palm resisting posterior aspect of the radius. And these are all against gravity. For a grade of 5 out of 5, they are positioned against gravity and can hold maximum resistance without breaking. For a grade of 4 out of 5, I am applying some resistance and they break. And for a grade 3, they break immediately. 2, 1, and 0 out of 5, the patient is going to be positioned with gravity minimized, so supine with the elbow flexed to 90 degrees. We're going to palpate the biceps brachii at the anterior elbow and stabilize the humerus against the trunk. In the gravity minimized position, you're going to start by palpating the biceps brachii, which is going to be important for differentiating between grades 1 and 0. For grade 2, they're able to move their arm, and so you do not need to keep palpating. For grade 1, you're going to palpate because they cannot visually move it, and grade 0, there is no muscle contraction. Movements are going to include shoulder adduction, shoulder external rotation, and ipsilateral trunk flexion.